Hey, I'm Dr. Rich Petrowski. I'm a general dentist with over 25 years of experience, and I'm teaching you about dentistry and teeth so that you could have a very nice smile. Okay, so in this video, I'm going to discuss what's a better option for you, fixed implant teeth or removable implant teeth. Now, for this video, I'm going to assume that you've already decided to get your teeth removed and you're getting implants. So we're not going to discuss the pros and cons or trying to hold on to your teeth. That's going to be for another video. So first up, let's step back and talk about what fixed teeth on dental implants are. You've heard the term all on four. It's basically a concept where you get at least 4 implants, sometimes more. I've had patients that had all on 6s, all on 5s, all on 7s. I think I even had somebody with an all on 8 once. But basically you get a bunch of implants placed. All your teeth are extracted, implants are placed, and then you get a set of teeth that are attached to those dental implants. And it could be attached either via, cemented onto implant posts, or most commonly they're attached via screws. So technically the teeth are removable, but your dentist is the only one that can remove them because they have to unscrew all the little screws holding them in. And then the other type of implant teeth are removable teeth, commonly called overdentures, snap-in dentures. Basically, again, person will have dental implants. So usually for the top, I recommend at least 4. On the bottom, you can sometimes get away with 2, 4 would be better. And on top of those implants, little posts are placed. Locator post is the brand made by the company called Zest, is the locator. It's kind of the standard shape and size snap that most people use, most dentists use. And a denture is made, an overdenture with a metal framework in it, but otherwise it's basically just a plastic denture, and it snaps onto those posts, and little snaps are inside the denture so you can pop it in and out. In addition to that, you can also have what's called a bar overdenture made, which is similar to that. It's removable, except that those snaps now are on a metal bar. The metal bar is attached to the implants, and then the denture fits on top of it. And I'll go over the pros and cons of that too later on in the video. There's also a third type called a telescope bridge. That's not very common here in the US. I know parts of Europe, especially Germany, it's much more common. The labs and the dentists there are trained to do it. But basically, it's a removable bridge, but it's fit onto telescope, basically just a smooth cylinder that's attached to the dental implants. And it just slides over top of it and it's held in. No cement's needed, but it's got a very good retentive fit, stays in very well. So that's a third type, but again, not very common here in the US. So what's best? Well, there is no best. It's all going to depend on your particular situation, what's going to be the right option for you. Saying one way of doing something is better than the other, it's like trying to answer the question, what's the best tool to have? A shovel, a screwdriver, a hammer? It all depends on the job you need to do. So same thing with teeth. Basically, you need to be able to chew and you need to be able to smile, look good, and speak. How you get there, there's different ways. So in this video, let's talk about some things you need to consider, things I go over with patients as when they come in and they're not sure what they want to do. These are some points I give them that I tell them so that they can think about it, and helps them make a decision as to what's going to be the best solution for their particular situation. So one big thing that I start off with is depending on the patient, does the person have teeth currently, or are they wearing full dentures? If you're somebody that has all your teeth and is planning on going to get dental implants, I recommend going to get fixed dental implants, because they're going to be the most like having your own teeth. Not exactly like it, but it's going to be the closest to having your own teeth again. If you're somebody who's currently wearing dentures, then snap-ins will work very well for you. It'll give you a lot of retention, and the dentures will stay in much better than your current regular dentures do. Now, The reason I recommend for people who still have their own teeth and they're considering implants to really think about the fixed solution is because with that you can actually, with those fixed teeth on dental implants, you can bite much harder than you can even with a set of snap-in dentures. Even the bar overdenture, where the denture actually sits on a bar, you can bite much better than you can with a regular set of snap-ons, but it's still not quite, it's not going to be as good as a fixed set of teeth. Okay, now if you're somebody who has dentures currently, top and bottom, then snap-in dentures are a great solution and you don't have to go with fixed. The snap-in dentures are going to be a much better improvement over your conventional regular dentures that you're currently wearing. And then there's people in situations where they may only have a denture on one arch and they still have natural teeth. I see this a lot. Usually it seems people lose most of their, lose their upper teeth. They have a full upper denture and then they have lower teeth still, their own natural teeth. In those types of situations, opposed natural teeth, I usually recommend that they seriously consider getting fixed teeth for the arch that's missing teeth. Just because with natural teeth still in their mouth, they can bite pretty hard with those natural teeth. And in some situations, a snap-in denture just won't stay in well enough versus, against when it's opposing natural teeth. So a fixed set of teeth will definitely work better versus a set of natural teeth. If you'd prefer something removable though against your natural teeth, then I would most likely recommend you go with a bar overdenture rather than just the plain snap style. That bar overdenture is going to give you a lot more support and you'll be able to bite harder and it'll hold up much better. Again, natural teeth against just the snap-in denture, it's going to come loose. The way you can bite, the amount of forces you can produce with your natural teeth on a snap, it's going to be much stronger than what the snaps can provide. Next thing to consider when deciding to get removable or fixed dental implant teeth is, how are you at cleaning your teeth? Most people, if they get to the point where they're losing their teeth, is usually either due to periodontal disease or very bad cavities. With fixed teeth on dental implants, while you can't get cavities anymore, you can still get gum disease around the implants, and you will have to clean your teeth every day. You're going to have to brush, you're going to have to floss, use super floss, use a water flosser to clean underneath that bridge, and you're going to need to see your dentist regularly. The reasoning behind it there is that if something starts happening with one of those implants, you start getting a little peri-implantitis, you want that caught early. Early on, it's usually just a matter of cleaning it up and it'll get healthy again. If you go a couple years and let it progress, you could end up losing an implant or two, or worst case, all of the implants. So again, I said earlier, having fixed teeth on implant is the most like having your own teeth again, and you have to clean them like you would have to clean your own teeth. So that's something to consider, because a lot of people think, oh, they're dental implants, I never have to go back to the dentist, I never have to do anything. And that's not true. You have to maintain them. You have to keep everything clean and healthy. With removables, it's not that you don't have to clean anything, it's just that by being able to remove the teeth, take them physically out of your mouth, it's a little easier to clean them. The overdenture, you can just clean in your sink. You can get a little ultrasonic cleaning baths leave it on the counter, pop them in there to clean them, and then in your mouth, you're not working underneath a set of teeth that are in place. You just have these little posts where the implant posts stick through your gums, and you just have to keep those clean. So it's going to be a lot simpler to maintain at home. You still should see your dentist regularly so they can evaluate the fit, make sure the snap-in denture is fitting properly, and that they can check the implants. Because again, if something's happening with one of the implants and you catch it early, it's usually easier to take care of it than to let it go, and then by the time it fails and the whole implant needs to come out, then that's more complicated and more expensive to fix. Okay, next thing to consider is, how expensive is it going to be? How much money are you going to want to spend on the procedure? Generally, fixed teeth on dental implants is going to be more expensive than a snap-in set of teeth on dental implants. Just the way it is. But the thing a lot of people don't think about is what are the ongoing maintenance costs once you have them. Again, people for some reason think, oh, I'm going to get this done. I never have to do anything to them ever again. And that's just not how the world works. That's not how life is. Is there anything out there that doesn't need maintenance, that lasts forever? No. Same thing with your mouth. If you think about it, teeth, you're using them, you're eating usually 2-3 times a day, putting a lot of stress on it, and things will break down. So part of maintenance is seeing your dentist regularly to get things checked, get things cleaned. What are some maintenance items that could happen on a fixed set of teeth? Well, depending on what material they're made out of, nowadays they could be made out of just solid zirconia, or that usually there's really little maintenance that can be done to that. Usually if those fail though, they fail catastrophically. The whole bridge ends up cracking somewhere and cracking in half, and then it needs to be redone. So at some point in time, there may be quite a cost associated with making a new set of teeth. Another type of material that they're made out of can be porcelain fused to metal. So basically it's a metal framework covered in porcelain, so it looks like tooth and gums. Those, what can happen, those tend to not fail catastrophically. More, what I normally see with those is the porcelain will tend to chip in here, usually on the teeth. Little bits will chip here, chip there. So with that, it's not quite as big an issue. It's more an aesthetic issue. But what I've done in the past for people too, if a little bit chips, you can just kind of smooth it, polish it, reshape it a little bit so it's not as noticeable. I mean, in certain situations, depending on the design, I know they'll actually make the teeth individual crowns. So if one of them chips off, you just cut the rest of it off, have a new porcelain crown made, and bond that into place in the person's mouth. Again, something to think about, something to discuss. That's still going to be not as expensive a repair compared to making a brand new full arch zirconia prosthesis, but there will be costs associated with that. Then the last type that's usually done for fixed is, this is like the original style. It's basically a metal bar covered in denture acrylic with denture teeth on it. Those pros and cons of that, they tend to wear the quickest because it's only plastic, but generally those are the easiest and least expensive to repair because those can be removed. The prosthesis can be sent to the dental lab and they repair it just like they would swap out a broken tooth on a denture. It's usually a day or two process, and the majority of the cost associated with that is going to be just the dentist removing it and reinstalling it once it's back from the lab. Now, the thing though with the fixed teeth though, there's a lot of new technology coming out there between milling machines, which are already available, but now 3D printing is becoming much more common. So this can all change in the next several years as the materials for 3D printing become better. The resins, it could get to the point where it's easy enough for the dentist or the dental lab to just 3D print a new one from the existing file that you have from the first time it was made. That replacement costs may go down in the future. We'll see on that, because when does anything in healthcare ever decrease in price? All right, now ongoing maintenance costs with removable teeth, the snap-in teeth, usually it involves replacing the snaps from time to time. Occasionally the posts need to be replaced. And if a tooth chips off it, again, it's usually a simple repair. It needs to get sent to the lab. Sometimes your dentist can do it in office. I usually like to send it to the lab so they can use the same exact acrylic that when he made the removable prosthesis. And it's usually pretty straightforward. If the whole thing needs to be remade, again, usually the replacement cost is going to be much less than a fixed arched if you need a brand new one, either zirconia or porcelain fused to metal made. Another thing to think about, I've had a couple people ask me, unfortunately they were people who had removable teeth, and they asked me, well, now that I have the implants, can I go to a fixed solution? And for that it depends, because usually before you start the process, it's where the implants need to be for fixed, like an all on 4, all on 5, all on 6, is going to be different than where they may need to be for removable. With removable, you can kind of get away with the implants maybe not being in the ideal location, and you can work around it because of the way the removable prosthesis is. So to go from removable to fixed, you basically, if you want to have that option, need to discuss it with your dentist ahead of time to see if it's even feasible. A lot of times, to have the fixed set of teeth made, in addition to placing the implants, they actually have to remove a bunch of jawbone because more space is needed to fit all the materials to, for the fixed bridge is just needs more space than a removable bridge. So it's something to think about. But if you've had a removable set of, removable dental implant, an overdenture that was done years ago, to go to a fixed situation now, actually may end up needing to get all those implants removed and replaced in more ideal locations, and so it may not be feasible. So I hope I gave you a whole bunch of things to think about, and you can make some decisions before you go to see your dentist to decide if you're going to go for fixed teeth or removable teeth on dental implants. And I really hope this helps up. Thank you guys so much for watching. I'd love to see you in my next video. Please give me a thumbs up and hit that subscribe button. I really appreciate it. Take care.